In this video, I'm going to discuss AC joint or acromioclavicular joint sprains. What can you do at home to try to return back to function and use of your upper extremity? Now, these are graded as a type 1, type 2, or type 3. Type 1 and 2 typically do not require surgical intervention. Type 3 at times do require a surgical intervention to repair the area. Now, what this is the acromion process. That's the back portion of the scapula, the shoulder blade kind of comes over, and the clavicle or the collarbone comes over and attaches to that. And that forms the AC joint. We see injuries here a lot of times in athletes or from falls where the arm is outstretched, or from an impact, say in football, where the shoulder is impacted from the front. You're going to see separation there or sprains in that area. And so a lot of times, the main things we're focusing on weeks 1 and 2 is edema control, pain control, just trying to kind of get everything to calm down. Maybe the patient's in a sling, typically an arm sling initially. And then in the next 3 to 4 weeks after that, we're going to really start working on more range of motion, returning strength, and then return back to functional daily activities or even sport, depending on the severity of the sprain, and then also if the patient's under the care of a doctor or an orthopedic surgeon, kind of what their guidelines are on that for return to sport and play. With grade 3, that typically requires the longest recovery. This can require recovery up to 7 months or greater. Also, depending on if surgery is indicated, there's a whole surgical protocol after you have surgery. So that will be dictated by the therapist or the surgeon or both after you have that. So initially, we're just going to go over those grades 1 and 2. What are some things you can do as far as returning back to normal function? Oftentimes initially with my patients, if it's okay and approved by the physician or the supervising therapist, whoever's in charge of that, I like to use home TENS units or even have the patient come in. We use our clinic units just to try to decrease some of the pain that's going on in that area, kind of calm everything down, make our exercises and range of motion activities that we're going to start doing a little more tolerable. You can also use moist heat or heating pads in the area, kind of draping that over the shoulder area. That does really well. Also ice, if you like to use ice packs, that's fine too. That's just preference of the therapist or of you, whatever feels best to you. So either one of those is good to also use in conjunction with that electric stim if that's okay. And any other type of analgesic or topical creams that you're safe to use, those are typically okay to use as well. If you've watched my videos in the past, you know that I'm a big fan of using tabletop slides with a pillowcase or a towel. I think that works really well at restoring range of motion of the shoulder for reaching overhead. It's really non-invasive. It's not as aggressive as trying to climb up the wall, so I like to definitely do these. So what you're going to do is you're going to put the affected side. So I'm going to say the right AC joint here is the one that's been sprained. That palm's going to go down. My other palm or hand's going to go on top of that. I'm going to work on sliding forwards and then just coming back. So most of the work that's going on here is being done by my left upper extremity, just kind of back and forth as far as you can. If that's too uncomfortable and you can't slide that out, you can kind of hold that position, you back away. So as you back away and lean in, you're going to increase that shoulder flexion range of motion. So the arm's going to come up overhead like that. So you just kind of lean back. So you can do that as well. I really like that technique. You can perform that for maybe 20 to 30 repetitions several times a day. Our next technique is going to be shoulder pendulum exercises. So what you're going to do is let the affected arm just kind of hang down. You can lean over, support yourself on a stable surface. And we're just going to work on kind of making circles. So I'm going to go clockwise, I'm going to go counterclockwise, I'm going to swing side to side, I'm going to swing back and forth. Now with that, a lot of times, you kind of encourage the patient to use their body weight to do more of that movement rather than just actively using their arm. However, I like to just have the patient, I actually don't care what they're using as long as that kind of swinging movement works, that's fine. So if it's more body English or body weight, that's fine. Or if they're using the muscles in the upper extremity, that's fine as well. And with that, I typically just time that. I have them do that maybe for 30 or 60 seconds to each direction several times a day. So we've been working on our tabletop slides, been using our electric stim maybe, or a heat or ice, or kind of whatever you're using there, our pendulum exercises. Now we're going to start into cane exercises. So this I usually will start after maybe 3 or 4 days. You're going to take a cane, you can use a broom handle or just really whatever you have, piece of PVC pipe, and you're going to work on bringing up the pipe as high as you can or the cane as high as you can. I'm using my left upper extremity or my non-affected side to do most of the work. I am helping with the right side. You're going to go up as high as you can and back down. Initially, you may only be able to go up a little bit, and that's fine. Just eventually work up to coming up overhead all the way. I usually have patients repeat that for maybe 10 to 20 repetitions for a few sets several times a day. Using the cane again, we're going to work on abduction or bringing the arm out to the side. So I'm going to use my left upper extremity, which is my non-affected side, really is doing most of the work. I am activating the right shoulder muscles while I'm doing this movement, but I'm letting the left upper extremity do most of the work. Go up as high as you can and come back down. And repeat that for 10 to 20 repetitions for a few sets several times a day. Now we're going to start working on our rotator cuff muscles. We're going to perform internal rotation. So you're going to bring your elbow in by your side. I have my band attached over here to our power rack, and I'm going to bring my palm in, kind of keeping my elbow tucked into my side here. I'm going to repeat that for 2 to 3 sets of 10 to 15 repetitions. A point to make with this, if that's too uncomfortable, what you can do is you can statically hold this next to your side, and you can work on step outs, just kind of coming back and forth, just stabilizing, almost like an isometric exercise where there's a muscle contraction, but there's no joint movement. I repeat that the same way as far as the repetition and sets. Now we're going to work on external rotations. I have the band here fastened to our power rack. My elbow is going to be by my side. I'm going to work on bringing my hand out like this, 2 to 3 sets of 10 to 12 repetitions. Now with this exercise, just like the previous exercise, if that's too painful, you can keep the elbow bent by the side like this. You can step out, step back in, step out, step back in. Next is going to be scapular retraction, so I'm going to pull back on the band as far as I can, really squeezing my shoulder blade together in the back. Repeat this for 2 to 3 sets of 10 to 12 repetitions. And again, just like the other exercises, if that's too uncomfortable, you can hold your elbow by your side and you can just take steps back and kind of come back and forth. I call those isometric walkouts. Those are really simple. It's an easy way to kind of grade into or progress into the more difficult exercises. Now we're going to perform shoulder protraction or a shoulder press, taking the band. You're going to push forwards, come out as far as you can, and then come back. Push out again, and then come back. 2 to 3 sets, 10 to 12 repetitions. With that one, you may have some discomfort if the elbow drops back past your torso, or it may be uncomfortable in full protraction out this way. So if so, just start in that mid-range and keep it that mid-range initially, and you can progress up to full range of motion. But just like all the other exercises with the band, you can extend the elbow, straighten that out, walk forwards, and then walk back. And then walk forwards and walk back. This program, like all of my programs, are not completely all-inclusive, and it's not a one-size-fits-all. This is just an introduction to get started back to movement, decreasing your pain, enhancing your mobility. Now, if you're playing a sport, you're a trainer or a therapist in that setting, is really going to work on more sport-specific things. If you're going back to work, especially if you're performing a job task that's very strenuous or you're an industrial athlete, then the therapist is going to increase the load and exercises to be more custom tailored to your return to work activities. Thank you so much for watching this video. Be sure and hit that subscribe button so you can stay up to date on all my content.